risk management process starts from project initiation, not from product deployment. That's the thing that people get wrong, is when you commit to starting a project, that's when risk management starts. So you should have already had in mind to ask vendors for their DCB. The challenge is when it gets too late. So once you've signed a contract, go live is 2 weeks away. Suddenly you've been dropped in it as a safety officer and you have to do your 160 and the vendor either doesn't have or doesn't want to share their 129. There's two scenarios. So one is you make it a blocker to going live, but there's also downsides to that because often you're deploying a technology to improve care. So delays to rolling out or stopping innovation also causes harm. So that's not always the safest thing to do. Absent that, you have to do then a much more comprehensive 160. The advantage of working with a mature 129 is that your job as a deploying organization is more straightforward and much more focused on the outstanding risks or residual risks that you need to mitigate. Without knowing what the residual risks are, you have to take this as a completely unknown product and do sort of a complete ground up analysis. And so it just makes it a much more involved and expensive process from a time perspective, but that's the way you have to proceed without collaboration with the vendor.
I was going to say, importantly, it can be done, but I think what also works is reminding the manufacturer of the law.
Yes.